I am Dr. Rajeshwari, Clinical Head at OSS Fertility, Banashankari, Bengaluru. Today, I will be talking on what is unexplained infertility. Unexplained infertility is there is no obvious cause for difficulty in conceiving in couple who are trying for more than 12 months with unprotected frequent intercourse. The tubes may be open, there may be evidence of ovulation, semen parameters may be normal, but the problem may be at the microscopic level. Unexplained infertility constitutes about 30% of all the infertility causes. Normally, when ovulation occurs, tube picks up the egg and allows the sperm to fertilize and form an embryo, and the embryo passes through the tube and comes to the uterus and implants there and grows. There are certain causes which are not obvious, which may be the causes for unexplained infertility. One thing is the HSG may be showing that the tube is normal and patent, but the normal tubo-ovarian anatomy may be distorted when there is some infection like endometriosis, and there can be adhesions where the tube can be pulled away from the ovary. There is distortion of the anatomy. The egg is released, but the tube is patent, but it cannot be picked up because the tube is being pulled away from the ovary. Next thing is there can be cervical factor. In the cervical factor, it can be a thick tenacious mucus which may not allow adequate number or the amount of sperm to enter the uterus and go meet the egg in the tube. The third factor could be the egg may be having a very hard shell, that is the zona what we say, where the sperm cannot penetrate and go and fertilize the egg. Now how to go about this? We need to do one diagnostic hysterolaparoscopy. In this hysterolaparoscopy, it can be diagnostic as well as therapeutic. If everything is normal, we are reassured that everything is fine. Sometimes there can be mild endometriosis which cannot be detected on scan. So this can be cauterized and treated. There can be infection and adhesions where the tube can be pulled away from the ovary and the tubo-ovarian relationship or the anatomy can be distorted. We can release these adhesions and try to restore as close to near tubo-ovarian anatomy. And once this is done, if the woman is less than 35 years and married only for less than 2 years, then these couple can be advised to take hormone injections and do an IUI. IUI is the well-processed sperms are put into the uterus bypassing the cervix. If there is any cervical factor, this can help the couple to conceive. If the woman is below 35 years and if she is married for less than 2 years, we can advise them to undergo this ovulation induction and IUI for 5 to 6 cycles. If the woman is more than 35 years, we can still advise her to undergo ovulation induction with hormone injections and IUI for about 3 or maximum 4 cycles. If there is no conception with this also, then we need to advise them to go for IVF ICSI.
For more information and updates, subscribe to Oasis Fertility. Hit the bell icon for future notifications.